It's Peter Barlis here, cardiologist. Now today we're talking about a commonly prescribed medication called Spironolactone. You might be on this drug for various reasons. We'll talk about what some of those reasons are and what this medication does.
I want to get all this and find nothing
Now Spironolactone is a therapy called a diuretic, and a diuretic means that we are using a drug to help lose fluid from the body. So this particular diuretic works on the kidneys to help release salt and therefore water and retain an electrolyte called potassium. And it's a medication that we use to help remove fluid from the body, and that can be as a result of the heart not pumping appropriately, so congestive cardiac failure, or it may be because of the kidneys not clearing out fluid in the body appropriately, or the liver that's not functioning. So it can be used for various reasons, but it can also be used for high blood pressure, because by acting to reduce the salt in the bloodstream and to clear the salt and fluid out, it drops blood pressure. So there are some other causes, and hormonal causes, particularly affecting the adrenal glands, can be treated by using this particular therapy. And in other situations, people who have a form of hair loss that is hormonal may also benefit from being on spironolactone. In terms of the heart, the two major reasons are that of high blood pressure and a condition called congestive cardiac failure. Now the term itself is not, a nice term to say failure, but essentially that's what is happening when the heart is not able to pump the fluid out appropriately, the blood out appropriately. Then there is a bit of congestion of fluid and blood in the body, and that causes people to feel quite short of breath. It can cause fluid to build up also in the ankles and feet and legs, and also sometimes in the tummy, a condition known as ascites. While spironolactone is a very effective drug to be used in that scenario. It's a tablet, and there are various doses. We often start off with a low dose, for example, something like 12.5 milligrams, and they often come in 25 milligram tablets and 50 milligram tablets, but that dose can be increased depending on the condition that we are treating. It is often very well tolerated, but because it lowers blood pressure, well then if you are prone to having a low blood pressure and you start this therapy, you may have a period of low blood pressure and therefore dizziness. Other conditions that we monitor when you are on this treatment is one called hyperkalemia, or increased potassium levels in the bloodstream. So we've got to be cautious about that, because there are various medications that we may use in combination, and some of those may cause a high potassium level, and having a very high potassium level can be a problem with respect to the heart. So we do ask that blood tests are performed regularly when you are on this treatment to monitor your potassium levels. And sometimes we are instructing patients, obviously, not to take any potassium supplements, or to keep an eye on how much potassium they are consuming in the diet. One of the fruits, for example, that is known to have a high amount of potassium are bananas. So other side effects which are less common but very important when you are on this treatment is a condition called gynecomastia, whereby in males and females the breast tissue becomes quite painful and tender. So in those situations we may elect to use alternative therapies if that side effect persists. But the therapy is often well tolerated, it's very effective, and in the case of the heart and heart failure, there is a definite benefit on being on this therapy, and it also has been shown to reduce the need to come into hospital with congestion or with exacerbations of fluid building up in the body. So again, a very short video focusing on what spironolactone is, a commonly used medication for blood pressure, for congestive cardiac failure, but also for other conditions affecting the kidneys and chronic liver disease and things like cirrhosis. Until the next video, bye for now.